Adopting a patient-oriented approach means putting the patient at the center. This approach actually developed under the name patient centricity in the United States and the United Kingdom at the end of the 1990s. It leads to taking into account patients' preferences and needs and personalizing the relationship. So, informing patients and their loved ones more transparently and involving them in medical decisions and care. It's a variation of customer orientation, which means that companies rely on their knowledge of the customer to build their marketing strategy instead of starting from the product. Customer centricity has been in marketing textbooks since the 1950s, but in practice, it really took off from the 2000s with digitalization and massive access to data. In healthcare, patient orientation is a major change. It challenges the asymmetrical relationship between a caregiver who knows and a patient who is treated as an object. The French National Authority for Health talks about a partnership between the medical team, patients, and their families, and about co-constructing a care option. This is about patient empowerment, both making the patient responsible and giving them power, which meets a societal expectation and makes them an active driver of their own health. Patient orientation is also a means, embraced by public authorities, to contain the healthcare budget. In many countries, populations are aging, which leads to more chronic illnesses and higher costs. Patient orientation puts patients and their families to work. For example, people with diabetes inject their own insulin without nurses. This trend is accelerating even more with the development of connected medical devices. Patient orientation has significant consequences. It introduces a segmentation of patients and a pathway-based approach. It therefore breaks down the silos between hospitals and community medicine, between medical and paramedical staff, between caregivers and the health industry, in order to work as a team. But it also creates ideological tensions, as it is sometimes seen as an unwanted intrusion of marketing into the world of healthcare. Finally, it raises the issue of vulnerable and non-connected patients.